Hey everyone, welcome back to the next episode in our laser parameter series using C-Wider. We're now on D, and D covers two main areas, and that's both dose and delivery. And these two are really, really important parts. And I always say, would you only take half paracetamol if you had a broken arm? No, of course you wouldn't. You would take the full dose. And this is something I see time and time again when it comes to laser, how often we are underdosing our patients. And then that's when, the outcomes become a little bit more difficult, shall we say. So dosing is our mg per mil in terms of vet language. And we can divide it based on how deep are we trying to get. The deeper the structure, the more energy we need to saturate those tissues to get the light where we're trying to get to. So we have our superficial category, and then we have our deep tissue category. And our superficial category, hasn't really changed in the recommended dose rates over the last few years. We're typically using 4 to 6 joules per centimetre square. With our deep tissue, however, this is where we have seen a lot of change. So it used to be 8 to 10 joules per centimetre square when it comes to deep tissue. After the back of a lot of research around, OA, hip OA, elbow OA, the degenerative myelopathy study, we've seen literally it saying, that if we're not dosing correctly, you won't get the same response. So using the correct dose is so important, and it's often something that's overlooked. So the more deep tissue guided dosing tends to be more at now 8 to 20 joules per centimetre square. And it's not just as simple as, how big is the area and then what dose am I going to use. We also have the patient characteristics that we again don't take into account enough. Every patient is different, and we shouldn't treat them the same. Have we got long hair, short hair? Are they more overweight? Are they quite thin in nature? Are they a greyhound? Are they a Great Dane? Are they a Chihuahua? All of those patients are different. What's the anatomy we're trying to treat? Are we treating an elbow versus a hip or a spine? All of those things are different, and we need to be taking them into consideration when it comes to getting accurate doses to then treat our patients properly, and make sure that we're not taking half a paracetamol, we're taking the full lot. So that's one of the first things I always double check when someone comes to me and says my patient's not responding. What dose are you using? Because a lot of the time we are underdosing these patients. And some people will say, well, what's the risk of overdosing? I'm a lot less concerned about overdosing than I am with underdosing. I don't think we've really reached that parameter, and I really think we'll see the research going a little bit further. So that's the first half of D, dose. I'll cover delivery in the next video.